Hello, my name is Courtney Spees. I'll be doing the diabetes insipidus case study on Mrs. Ford. She's a 32-year-old female. First thing I'm going to do is go into her room and look at the positioning that she's in, look how many side rails she has up, see if her bed's locked, um, see if she has her call light in reach, if she has her ID band on, or any allergy bracelets. I'm also going to make sure that she has no obstacles to any exits or to her bathroom. I'm also going to look to see if her bedside table is beside her and if she has any fluids running, she has an IV, any oxygen, any drains, just tubing, Foley's, anything like that. Um, and then I'm also going to make sure that I know how many side rails she has up. So the first thing that I'm going to do is tell you that she came in 2 days ago after a fall, and she is a epidural hematoma. She is also vented. Um, the first thing that I'm going to do is ask her name and her date of birth, and then match that to her ID bracelet before I start any assessments. I went ahead and did her vitals first, and it was 124/68 with a MAP of 86, and heart rate is 84. Her temperature is 98.9. Her respirations are 16, and she's on the ventilator. And then I went ahead and looked in her chart, and her intracranial pressure was noted to be 12. So the first thing I'm going to do is ask her name and date of birth, which she's vented, so she most likely can't speak. But like I said, I used another patient identifier, and I looked at her bracelet. I'm also going to ask her if she's aware of time, the day, person, which she was not oriented to. Um, the next thing I'm going to do is do her neuro assessment, so I'm going to have my handy dandy pin light. And I'm going to click and then click, making sure that I'm coming out or in. And I got 4 millimeters. And the next thing that I'm going to do is turn her head to the right and no JDD, no JVD. I'm going to go ahead and take a look at her skin, which it's pink, warm, dry. It looks intact. And then the next thing I'm going to do is feel her pulse. Pulse is up here. Okay, they're present. And then I'm going to ask her to push pull, which she's very weak, so she's not able to do. Wiggle fingers, not able to do. And then so we're going to go ahead and check her cap refill since she's not able to do those things. I'm checking each finger on each side, so it's less than 3 seconds. I'm also going to note if she has any edema on her upper extremities right now, which she doesn't. And then if she has any paresthesia, tingling, numbness, pain, anything in her lower extremities. So the next thing I'm going to do is go ahead and listen. And since she's vented, I'm just going to go ahead and assist her to turn on her back so I can listen to her other respirations. Yep, just stay right there. Okay, and then while I have her rolled over, I'm obviously checking her skin on her bottom and her back. And then I'm going to do this to check whether or not her ventilatory depth is equal. Can turn right back over there and help you your position. Okay, so her lungs were clear bilaterally, and her depth was also equal. So I'm going to go ahead and listen to her apical heart rate. So it's 70 and regular. The next thing I'm going to do is do her abdominal assessment. So I'm looking at the skin, noting if there's any bruising, anything like that. The first thing that I'm going to do is inspect her abdomen, which I told you that. The next thing that I'm going to do is palpate. Any pain? Miss Ford also is responsive to a pain stimulus, so if there was any pain, then she would obviously respond. I'm going to go ahead and auscultate her basins. They are present in all 4 quadrants. She's unable to state whether she's able to pass gas or when her last bowel movement was. Now that she's laying her back again, I'm also going to finish up her respiratory assessment. The next thing I'm going to do is ask her if she's had any vaginal discharge or pain while urinating. I'm also going to look for any presence of discharge or any odor, anything like that, skin breakdown. I'm going to go ahead and look at her lower extremities now. I'm going to do push-pull, which she's weak, so she might not be able to do that. I'm also going to look for any edema, any paresthesia, pain, numbness, tingling, anything like that. Do her cap refill on every toe down here. And then also feel for her pulses. So after that, we're going to go ahead and say that she had no edema. Her pulses were present bilaterally, just a little weak. Her toes were cool to the touch. And she also responded, I would just take my pen or my pen light and kind of just rub it on the bottom of her feet. And she responded to that as well. So the next thing that we're going to do is we have an order to place a Foley. So I would ask if she's ever had a Foley before. If she has, how did she tolerate it? I'd ask her if she was allergic to any shellfish, since we're going to be using betadine to prep her skin with. I'm also going to ask if she's having any pain right now. So I'm going to go ahead and place a 14 French. The Foley will just help you empty your bladder out, and then it'll also give us a pretty accurate reading on your output and everything like that. So the first thing I'm going to do is wash my hands, and I have my supplies gathered, and I apologize because I'm working at a little table on a couch. So let me just move this so you can see a little better what I'm doing. Okay. So I have my sterile gloves, and then I have my Foley kit, which, once again, I'm sorry, I tried to wrap it as neatly as I could. So the first thing I'm going to do is take my Foley kit and place it over here by the patient. I'm going to go ahead and take it out. I'm going to go ahead and have her hike her legs up right there. So the first thing I'm going to do without my sterile gloves on, still can't see me, is unwrap the Foley kit. I'm making sure that I stay within that 1-inch border so I'm not breaking sterility. Away. Side, and towards me. Okay, so now that my prep field is done, I'm going to go ahead and put on my sterile gloves. Making sure I know you can't see me, but making sure I'm still maintaining that 1-inch border. Stay down. Grabbing the outside of the cuff. Making sure I'm not touching anything. Making sure I'm not touching anything. Not touching my skin. Ah, get on my hand. And then I'm just going to pull and adjust as needed. I'm just going to leave my cuffs alone, my wrist alone. So maintaining sterility here. So the first thing I'm going to do is go ahead and she's already on an incontinence pad. So I'm just going to drape this over the area that I want. And I'm going to go ahead and place this right beneath her, which this is all sterile, so I'm not touching anything. I would go ahead and open up the Betadine packets. I'm going to go ahead and open up my syringe with my sterile water. Open up this Betadine. I'd pour it all over the little cotton balls. I'm going to go ahead and open up my lubrication and I'd squirt that into my tray here. I'm going to go ahead and move this and get my catheter out. Let me just readjust here. So I'm going to go ahead and slide my catheter out. We're going to go ahead and blow the balloon up to check for making sure there's no like leaks or anything. Okay, I'm going to pull that fluid out again, making sure I pulled it all out. I'm just going to leave this attached. And then I'm going to go ahead and I would lube up this already. So lubing it up, and then I'm just going to set it right into the tray. So it's ready for me to go ahead and take. So these already have Betadine on them. So I'm going to go ahead and spread, which now my hand is contaminated. So I'm going to go down one side, throw away, down the other side, throw away, and one side, throw away, other side, throw away, and then in the middle. So now I'm going to go ahead and ask her to take a couple of deep breaths to relax. It'll help. I'm going to go ahead and grab my Foley, which I'm kind of in an awkward position because, yeah. And then I'm going to go ahead and tell her to take a deep breath and to bear down. She's going to feel some pressure. So I'm inserting all the way in there, inserting. And then I'm going to wait until I would see fluid, obviously. Then I'm going to push that just a little bit more once I see urine, just to ensure that it's inside the bladder. And then I would go ahead and fill the balloon up. Okay, so that balloon is inflated now. I'm going to go ahead and disconnect. And then I'm going to watch the urine flow. I'm going to note how much urine is coming out and then the color of the urine. I'm going to ask the patient if she's having any pain, if she's experiencing relief. Jack, leave those alone. So yes, the Foley is inserted. And that was 14 or 16. 16 French. Alright, so I'm just going to move this out of the way. I'm sorry. I apologize. I realized that I grabbed that with this hand, but I was just trying to, like, make it not fall over. What a fun time. All right. So, hey, give me that cotton ball back. You little crazy person. Quit it. Are you serious? Hold on. My cat ate my cotton ball. Come back here. You're going to choke on that. Whatever. Had to go answer a call light. So, all right. So the next thing that I'll be doing is starting her fluids. So right now I have a order for 75 mLs per hour. And before I start anything, I'm going to go ahead and do just like how I did the Foley and do 2 patient identifiers. So in this case, she's not able to speak, so I'm just going to look at her bracelet and then match that to her chart. And then I'm also going to do the rights. So I'm making sure that I'm looking at the order, that I have the right drug, the right patient, the right dose, the right route, the right time, and then the right reason and response, which I'll get those later. So what I do first is I'm going to I'm going to wash my hands first, get everything I need. I'm going to get a flush, and then I'd have gloves on as well. And I'm going to go ahead and prep pad, alcohol prep pad, her saline log, and then I'm going to prep pad this. So I'm going to open this, and then I'm going to flush her IV to check for patency before I start running the fluids. That way I won't cause any infiltration or anything like that. Okay, and then I'm going to go ahead and get the fluids ready, which I apologize, I don't have a bag with me. So the first thing that I do, this is obviously would be in a bag and be new tubing. The first thing I do is get new tubing. I get the bag. I check to make sure that the bag is the right fluids and the right volume that I need. I'd also make sure that I label the bag, and I'm going to make sure afterwards I label this tubing as well. I'm going to go ahead and